Speaker, my question is to the Minister for Health and Regional Health. Can the Minister please update the House on the Minns Labor government's efforts to drive down pressure on emergency departments while making it easier and cheaper to access health care?
Thank you, Mr Speaker, and I thank the member for her question and her advocacy for health services in Western Sydney. I'd like to acknowledge ALP branch members from our region who are here today. My favourite high school teacher, Mr Brian Dellett. My sister was his favourite student, but I'm distant 25th, I think. But anyway.
It was only 24.
Thank you for being here, Mr Speaker. We've got a real responsibility at the moment. Anyone who's in touch with their community in this place will tell you that cost of living challenges now, and parents running busy families and single parents running often even busier families are really doing it tough, both in time and in money in the family budget. And I know when I move around my own electorate at my children's footy games on Saturday, this is what people are worried about and this is what they're concerned about. And we have a responsibility in health to meet people where they are at. And we, over the last couple of years, have tried extremely hard to reform the health system so it was a system that put patients and the community at the centre, and not always thought that we had to have clinicians at the centre. And we are doing that in a significant way, but there is so much capacity to do more, Mr Speaker. Many of you would have heard around our virtual and urgent care services, free services that people can access through Health Direct on that 1800 022 222 line, Mr Speaker. But there is a challenge. A few years ago, we had about 4,000 people using those virtual health services. In this fin year, we've probably tripled that, but we've got the capacity to have around 85,000 ED diversions by people using those services. So our message today to the community is, if it's not an emergency, please access these free health services through Health Direct. They are easy to access, they are free of charge, and they are convenient, particularly convenient for working families at the moment who are doing it tough both financially and by way of time. Mr Speaker, we're also doing a lot more to make healthcare more affordable and accessible, and we are rolling out the free flu mist for our youngest patients under the age of 5. That is free. Why is that important? Because our young patients are the sickest when it comes to the flu, and they, along with our oldest patients, take up the most hospital beds this time of year as we enter into what will be a difficult flu season. So we want you to also be able to access that service, Mr Speaker. We also provide free dental, Mr Speaker. Free dental.
Member for Pedro.
I seek an extension of time.
Mr. Free dental for children under the age of 17 through one of our public dental health clinics, easily accessible through New South Wales Health. Again, information on Health Direct line. Really important that people access right at the moment these free initiatives, but we as a government need to continue to do more to get this information out there, and I encourage members, whether it's through your newsletters, through your interactions with your community, to make sure your community know that you know right now that their family is doing it tough and that there are ways to save significant amounts of money. We estimate about $1,200 on healthcare using these reforms that taxpayers have funded and that we have established over the last few years. Mr Speaker, wanted to get a better understanding of the experience of someone using one of our virtual healthcare services, and I had an opportunity to speak to Shelby recently. Her daughter Evelyn was unwell late at night. It's the classic time. It's like when most of our kids get sick, Sunday night. Very little access obviously at that time to GP. No doubt tried to get into a GP. Delays in getting GP, there's also a cost. She had an opportunity to use Health Direct on that virtual health service to access a consultation, a video consult with a paediatrician. This is what she said. I've been now telling all my friends that it's been absolutely wonderful. An easy program where most importantly you can be heard and reassured, and importantly for us, listened to. and your little one is assessed right in the comfort of your own home. Mr. Speaker, this is about taking healthcare and meeting people where they're at. And we are going to continue to do this reform. We've got a responsibility to make healthcare more affordable in New South Wales, and we've got a big responsibility to make sure it's more accessible. We'll continue to update the House on it.